speech. So I thank you all for coming each time, or if this is your first time, good luck listening to me. This is supposed to be a persuasive speech, so by the end I should have at least tried to persuade you on the point that I'm trying to make. I hope that it's not something that is offensive, but it's something that I feel strongly about. So, vaccines have increased our lifespan by 30 years. However, more than 3 million people die from vaccine-preventable diseases each year. 1.5 million of those deaths are children under the age of 5. As an American, I have the right to say what gets injected into my child and what does not. But where do we draw the line on that right? It isn't only my child that's affected when they get the shot. Those with suppressed immune systems or infants that are too young yet to be vaccinated also have to be taken into account. Is it ethical not to vaccinate my children? The sun rises in the east, it sets in the west, the earth is round, and vaccines save lives. I'm going to talk to you today about how we've gotten into this war we're in between anti-vaxxers and pro-vaxxers. I'm going to give you the facts about vaccinations and how to use those facts for what I believe is good. So here is what diphtheria, polio, measles, mumps, rubella, pertussis, hepatitis B, what they all have in common. They are all vaccine-preventable diseases that cause deaths worldwide, often because vaccines are unavailable, but the U.S. has no excuse. Our outbreaks and deaths are from these diseases, often because they are not taken advantage of and they're discarded as harmful. There are 16 total vaccine-preventable diseases. Children are vaccinated against 14 of them in their first year of life. Dr. David Satcher, Assistant Secretary of Health, Department of Health and Human Services, and Surgeon General of the United States says, for most of the vaccine-preventable diseases, there has been a 95% more reduction in cases. This has occurred because states, territories, and local governments have instituted effective immunization programs. So during the early 50s, over 16,000 paralytic polio cases and over 1,800 deaths from polio were reported each year. As of 1991, thanks to vaccinations, polio was eliminated. In 1988, the year that I was born, approximately 1 in 200 children under the age of 5 developed HIV. Now, HIV is a disease that is the leading cause of bacterial meningitis, and it was affecting children under the age of 5, accounting for 60% of all the cases. So many children became hearing impaired, and 420 kids died every year. It was also a leading cause for acquired mental retardation. By 1998, 10 years later, vaccinations reduced the number of HIV cases by more than 90%. Between 1964 and 1965, 12.5 million Americans were affected by rubella, measles. 2,000 babies died, and 11,000 babies were miscarried in that 1 year. Today, thanks to vaccinations, rubella poses virtually no threat in the United States. We have come a long way in the last 60 years, but the fight against disease has become more difficult with younger generations deciding to stop vaccinating their children. And this in turn affects other children. Cynthia Cristofani is a doctor, a pediatric internist. She says, we're compelled by our own fears. Older generations witnessed firsthand the diseases that my generation knows to not exist anymore. Many of you likely saw people who had polio. You may have experienced measles. I myself had chickenpox. It was a rite of passage. You had it before you hit kindergarten. People put their kids in the same rooms together so that their kids could get it. There's vaccination now. You don't have to have it. Today, young parents know nothing except rumors of polio and measles. They don't know the deaths and tragedy that it can cause, like maybe many of you can. They're more scared of gluten and aspartame than they are of measles, which is scary. It's very sad that an outbreak could be the way that their eyes are opened, because apparently seeing is believing now. The CDC admits that the U.S. has a very low rate of vaccine-preventable disease deaths, but that isn't true of the rest of the world. And while the rest of the world seems very far away, people love to travel. So honestly, it's really only one plane ride away. For example, in 2014, the Philippines saw over 58,000 cases of the measles. The U.S. experienced 400 cases that same year. Put two and two together. Somebody sick from the Philippines came here and spread the disease. It actually hit an Amish community in Ohio that didn't believe in vaccinations. So, as you can see, Americans are not safe simply because we live among people who are disease-free. We are disease-free because we have been preventing disease with good health practices such as vaccinations. If we stop these preventative measures, we will be reverting back to the times where we were crippled by polio and killed by measles. Through internet blogs and misguided research, people have come to several conclusions about why vaccines are bad or harmful for their children. Perhaps you've heard of Andrew Wakefield. He is was a gastroenterologist in Britain. He wrote a study that was published in 1998 in a medical journal called The Lancet, and he linked the triple MMR vaccine to autism. After this paper was published, people everywhere stopped vaccinating their children against measles, mumps, and rubella. And this resulted in an outbreak in many places and even deaths. So, in 2010, The Lancet retracted the article, saying that it was scientifically flawed. Wakefield was later stripped of his license to practice medicine. Long story short, he fixed the study to make his opinion seem as though they were facts, and it affected people everywhere, and he is responsible, I believe, for the death of children that came down with measles. 12 studies since then have been conducted and have scientifically concluded that vaccines and autism have absolutely no connection whatsoever. The very sad and concerning part is that thousands of dollars and hours have been wasted trying to find a link between autism and vaccines that doesn't exist. Those dollars and hours could have been and should be put towards finding a cure for autism. The children and adults that are affected by it aren't getting any closer to a hope of a cure by searching where one can be found. We, as responsible humans, should advocate for vaccinating our loved ones, not only for their sake, but for the sake of our communities. Study after study has been done, and vaccinations have been proven to do more good than harm. The schedule set for these inoculations has been studied and proven to work. If we ignore science, others are hurt in the process. I'm going to tell you about Vanessa. She was 40 days old. Her lips started to turn blue, and she couldn't breathe. Her parents stood by, helpless. They couldn't do anything. They called the ambulance. They took her to the emergency room where they placed her on oxygen and tried to clear her lungs. Her status was so dire that a chaplain was called to her room. They did not think she was going to make it. Vanessa had pertussis, which she was 40 days old, which means she was a week shy of being able to be given a vaccine to prevent pertussis. So she lived, but she was lucky. Also, Rhett. He's 7 years old, and he's had over 50 surgeries and multiple procedures in his young life. Rhett has leukemia. He is in remission, but treatment has wiped out his immune system, making vaccines impossible. So the difference between Rhett and other children is he cannot fight against maybe MMR or measles, mumps, rubella. Other kids can't because they have a healthy immune system. I am a parent that feels it is my duty, not just for my children, but for other people's children, my friends, my neighbors, my family, to vaccinate against deadly, debilitating disease. If we stop and take preventative measures, if we step up and take preventative measures proven by science to work, we can keep a healthy community with happy, healthy children. Disease is an illness, and disease and illness are costly, not only financially, but physically and mentally. If we can prevent that, why not? I urge you to learn facts, shuffle through the garbage. Talk with your children and grandchildren about the importance of vaccinating. We can't wait for polio to cripple us again. We can't wait for measles to become a child with rite of passage. Now is the time to act before an outbreak. The sun rises in the east and sets in the west, but the The earth is round and vaccines save lives. Research has proven that vaccines are the answer to preventing disease and death. Science has the upper hand when it comes to the facts here. I am not against finding a cure for autism, but let us stop looking in the wrong places. Help me cut the number of vaccine-preventable illnesses and deaths in half by spreading the word and convincing your family and friends that vaccines equal life, health, and happiness.